Good afternoon and welcome back to Downing Street for today's coronavirus press briefing. I'm joined by Professor Steve Powis, the National Medical Director of NHS England. And before I turn to our vaccine delivery plan, which we've published today, I wanted to go through the latest coronavirus data. As we know, the new variant of this coronavirus is highly contagious, and it's putting the NHS under very significant pressure. Yesterday, 46,169 positive cases of coronavirus were recorded across the whole of the UK. And as the slide shows, 32,294 people are currently in hospital with coronavirus. That's across the UK, and as you can see, that is up sharply, even on just a week ago. It's up 22% on this time last week. The average number of deaths reported each day over the past week is 926. And our hearts go out to the family and the loved ones of each and every person who's died with coronavirus. As the Chief Medical Officer said earlier today, we're at the worst point in this pandemic. And you can see that from this slide and from the increase in number of people in hospital. So the NHS, more than ever before, needs everybody to be doing something right now. And that something is to follow the rules. And now I know there's been speculation about more restrictions, and we don't rule out taking further action if it's needed. But it's your actions now that can make a difference. Stay at home, and please reduce all social contact that is not absolutely strictly necessary. That's what's needed. Act like you have the virus. And it's all the more important to do all of this because the vaccine rollout is now proceeding at pace, and we all know that this is the way out of the pandemic. I'm determined, as I have been for almost a year now, to drive this vaccination programme as fast as is safely possible. I'm determined to ensure every adult in this country has the chance to be vaccinated, and that as many people as possible take up that chance to be vaccinated. And vaccines are important, and I care about vaccines because I want our country to get back to normal as fast as possible. I want us to have that great British summer. And my team and I are working hard to deliver this as fast as possible, both to save lives and to make people safe and to protect the NHS and reduce the very significant pressures it's under right now. I wanted to bring you up to speed with the very latest statistics on vaccination. So far, across the UK, we've given 2.6 million doses to 2.3 million people. And we've protected more people through vaccinations than all other countries in Europe put together. Today, I'd like to take you through the details of our UK vaccination delivery plan that we've just published. It sets out how we will build on the work that's been done so far and put in place the biggest vaccination programme in British history. There are 4 parts to the plan. The first is supply. I've always believed that British science would come and find the solutions to get us out of this. For a year now, we've been working to develop and buy vaccines for everyone in the UK. Thanks to our investment in Ebola and MERS vaccines several years ago, the Jenner Institute at Oxford University was able to repurpose the work that it was doing and move so fast to develop a successful coronavirus vaccine. But our search has been global throughout. So whilst we've backed the scientists who are working on this here at home, we've also worked with international partners like Pfizer and BioNTech to ensure that we were the first country in the world to authorise and use the Pfizer-BioNTech vaccine. And of course, the Moderna vaccine is now authorised and ready to bring on stream. I want to thank everybody who's been involved in this, but the work is not yet done. The supply of vaccine is the current rate-limiting step, and we will bring forward as much vaccine as becomes available. And we must ensure that we have the vaccine development and manufacturing capabilities in this country for the future too. The next part of the plan is prioritisation. This has been much discussed. The plan sets out how we prioritise the vaccine so that we can protect those at greatest clinical risk. And one simple statistic explains why this is important. The top 4 priority groups account for 88% of the deaths from COVID. This stark fact explains why we must prioritise according to clinical need to save lives, and because that is the fastest route to safely lifting restrictions. We're on track to deliver on our pledge to offer a first vaccine to everyone in the top 4 cohorts by the 15th of February. And I want to give you an update on progress. 2/5 of over 80s have now received their first dose. Care home residents are, of course, in the very top priority group. In the last few days, since the Oxford vaccine was approved for use in primary care on Thursday morning, we've significantly accelerated the care home vaccination rollout. Almost a quarter of older care home residents have now received their first dose of the vaccine. And we're committed to reach every care home resident this month, and I want to see as much as possible of that as soon as possible. I'm incredibly grateful to everybody working in social care, whether in care homes or in domiciliary care, for everything that they're doing to keep the people who are the most vulnerable to COVID, to keep them safe right now. This is not easy, but it is vital. And it's vital too that when the vaccine reaches your care home, that everyone, residents and staff alike, step forward and get that jab. Each of these jabs saves lives, and we're making this happen as fast as we can. The plan sets out how we'll continue through the clinically prioritised groups and beyond, so all adults can be offered a vaccine by the autumn. The third part of the plan is expanding where you can get vaccinated. As of Friday, 96% of the population in England lived within 10 miles of a vaccination site, and we're expanding the number of vaccination sites further right across the whole of the UK, with the devolved NHS responsible for delivery in each of the 3 devolved nations, Scotland, Wales and Northern Ireland. This expansion will include community pharmacy and roving vaccination centres, on top of the hospitals and GP practices and the 7 mass vaccination sites that we've opened, including the one I visited earlier today at Epsom. This huge expansion means that by the end of January, everyone will live within 10 miles of a vaccination centre, either fixed or roving, in England. And this will help us make sure that everybody can get access to the vaccine that's so important. And the final part of the plan is about the people who are making it happen. Over the past few months, we've recruited and trained an 80,000 strong vaccination workforce. I'm incredibly grateful to all those who've stepped forward, including people from all parts of the NHS, retired clinicians, pharmacists, airline cabin crew, the armed services, St John's Ambulance and the Royal Voluntary Service, and so many volunteers who've come forward for their country. Thank you for your service. And I'm very grateful for the many offers of support we're receiving right now, and for all those who are in training as this vaccination rollout expands. So that is the vaccine delivery plan. It is an incredibly important piece of work. But while this crucial work takes place, each and every one of us must keep pushing back against this virus by following the rules that are in place. Please do your bit and help keep the NHS strong while we roll up our sleeves and make this ambitious plan a reality. So please stay at home to protect the NHS and save lives. We're now going to hear a few words from Professor Powell. Price before taking questions from the public and then from the media.
Thank you, Secretary of State. So like you, this morning I had the opportunity to see firsthand the next phase of the development of the NHS's rollout of the mass vaccination programme across England. Like you, I met staff in Epsom as they offered the vaccine to some of the hundreds of thousands of people most at risk of COVID-19, who are this week being invited to get a jab. Epsom Racecourse is one of 7 large sites across the country opening this week, bolstering the ranks of the GP surgeries and hospitals which have been delivering COVID vaccines since the beginning of December. These services will be joined later this week as pharmacy-led sites begin to come online, giving us more than 1,200 settings in England that people can come to get their jab. As you've heard, more than 2 million doses of the vaccine have now been given out in England. And today, again, as you've heard from the Secretary of State, a detailed strategy has been published outlining our plan for continuing this important momentum. And as Sir Simon Stevens, Chief Executive of NHS England, said earlier today, we're in a sprint. Alongside social has already gone up by a third, a rise of around 8,000. We are seeing stubbornly high levels of infection and, unfortunately, death too, which is a sadly inevitable consequence of the rapid spread of the virus in recent weeks. Hospitals throughout the country are now seeing significant and sustained pressure from those rising numbers of COVID-19 patients. Even in the area of the country with the lowest number of patients, the South West, has more people in hospital now than the entire country combined did at the end of September. And with hospital admissions typically occurring around 2 weeks after transmission of the virus, we're still to see the full impact of the Christmas loosening of restrictions reflected in those hospital numbers. So in short, as the Chief Medical Officer and the Secretary of State have